shift to complementary medicine?
Oh, it's a good thing. So after completing my MBBS degree, I started practicing for private practice at Kumbakonam. It's in the central Tamil Nadu. I was practicing in a Muslim area. The people are so lovely, so they are so friendly. They treat me not only as a doctor, but a part of their family. That is how the story goes. That was the doctor-patient relations which you used to maintain in those days, in 70s I am talking about, late 70s. Okay. So while I was very happily, actively, I engaged in my private practice, thinking that I'm going to change the whole world. I'm going to give the best medical facility to all the people in and around me. Likewise, I was very so much interested in doing, and I love my profession. I had a beautiful passion towards my subject. But with all those things, I meet the patients, I give them treatment. Out of the 50% patients daily I meet, nearly 30 to 35 patients will be either they will be coming for hyperpyrexia, that is fever, or for acute gastroenteritis, that is diarrhea and dysentery. These are the two common conditions we encounter. But the thing is, out of all those things, the patient, they do come for arthritis, they do come for asthma, because being a Muslim area, because they use more incense, that is scent and the cosmetics, so the chances for asthma is very common in those areas, and skin problem. When the patients come that for that reason, I gave them treatment. But before they go, what they usually tell you, because you know very well arthritis, you do not have a exact medicine to treat arthritis. So what we do, usually we give analgesic to subside the pain. They do not feel the pain, but the problem will be there. That's a problem in arthritis. Asthma, when they come, I can relieve their problem. But actually, I cannot stop it not to come again. That is the problem. So again and again, they'll be keep coming. So each and every time when I come and go, they say, hey, my son, you are giving wonderful treatment. But very unfortunate, I'm not becoming normal. When they say so, could I take it as a compliment or as a comment? And I was a little worried because I'm getting money out of them. But after collecting money, but I'm not justified in giving them the right treatment, I was a little upset. Then I started thinking about an alternative that time. That was my mindset. That time, right from day one, I'm an academician. I would like to document everything about all the patient's histories, and I would like to document everything because presenting paper in the conferences, I always love to do that. Because what I think, whatever you experience should be shared with their colleagues. Then only there will be a growth in the mind and the knowledge of the system. This is what basically I used to do that in those days. So likewise, I presented a paper on asthma, bronchial asthma. I was made to sit on the dais because I'm going to present a paper. Another man was presenting the paper. I was sitting in the dais. That time, the organizers brought one old man. He should be around 60 years. I was hardly 30 plus. He was around 60 plus. They brought him and made him to sit by side and said, Dr. Muthu, kindly take care of him. He is one of the topmost acupuncturists from China. He has come all the way from China to present a paper. You know very well, in those days, we doctors, allopathy doctors, we always feel we are superior. Because whatever we were taught, whatever we learned, everything, it came after a humpty number of researchers doing R&D. And with the scrutiny of the so many doctors, it has been told to the students, medical students. Likewise, everything is authenticated. So always we think superior in medical field. We always look a little lower about all the other people, other modality of treatment. So, because I was young, I was in a very bad state, I can say. I started abusing him in the dice itself. Like keeping my mouth like this, I leaned to him and I started abusing him. What man? You are saying you are a doctor from 60 years old, and why you are literally cheating the public? With a needle, how come you can produce an effect in the body? What do you say? Can we ask all the pharmaceutical companies to shut down and go out? Is this the way you treat? Don't you have God fearing? Likewise, I was abusing him. With a happy smile, as you know, most of the Chinese, they keep smiling always. With a happy smile in this, he started, after seeing my name card, he said, your name is Dr. Muthu? Yes, I just said, I am Dr. Muthu. Could you please explain me what is angina pectoris? Angina pectoris is nothing but a heart attack. Immediately I jumped over him and told him, even if I explain you, how come you understand? You are a non-medical man. You cannot understand what I say. No, Muthu, you please tell me. Let me try to understand. I told him it's a precordial pain. This part of the chest is called precordium. So it's a precordial pain, pricking in nature, radiating to the medial part of the hand. This part is called medial and this is lateral. So radiating to the middle part of the hand and more felt in the tip of the little finger. This is what I was taught. So I told him. Happily he said, Muthu, I am very happy and 100 marks I can award to you. But could you please explain, when you got a problem in the heart, how come you got a pain in the little finger? What is the connection between both things? I am out. Because as a student, I asked my professor the same question. While taking classes, we used to ask them, sir, how come, sir, you got a pain here, but it's felt here? In our allopathy, there is a subject that is called a referred pain. The problem will be somewhere, but it will be felt somewhere. This we call this as referred pain. But 110%, I know, these are all unexplained things. In a general name, we can say referred pain. No. Everything should be explained. Then only it will be scientific. So in those days, we do not have an alternative, so we say yes, and we got it by mind. So I told him referred pain. The moment I told him referred pain, he started laughing this way, that way, and he was literally laughing. I got irritated. I said, man, look here. I know my limitations. This is what I was taught. You tell me. Because you were mocking at me. You were literally laughing. You tell me. I was damn sure he couldn't give me an answer. But to my worst surprise, he took a paper out of it. There was a figure there, a diagram. He showed that figure to me. It's a meridian, it's a human body with a heart meridian. Heart meridian, it starts here, runs all the way, it ends in the tip of the little finger. He told me, Dr. Muthu, basic physics, you take a wire, the potentials will be more felt in the end and moderate in the center. That is the reason you got a pain here, you got a pain, more pain here, and a moderate pain, this one. I was totally out. Because I am one guy, I don't teachers. I never play with them. I'll never be very little sumptuous with them. I'll be very, very, very sincere. I love them. I literally adore them. So with all sort of respect, I told him, sir, I'm very sorry. I played with you. Whatever I said, I ask apology. Kindly bear with me. I'm very sorry, son. I was totally taken back. I never anticipated this sort of result answer he is going to give me. So I started looking at the man who was presenting the paper. Again, he called me, Dr. Muthunan. And with a fear, I turned to him. Yes, sir, what is it? Can you tell me, gents and ladies, who are using more spectacles in the old ages? I said, sir, honestly telling you, in ophthalmology, it has not been taught. Because it was not taught in ophthalmology at all. This population, gen population, be more speculative. I was like, no, it has not been given at all. I said, we do not know, sir. Why don't you make a guess? You make a guess. Why don't you do that? I started thinking about my relatives, my friends, doctors, and all my professors. And I could see only gents are more spec than the ladies. One happily I told them, sir, gents will be using more specs. How come, Muthu? They are coming out, working in the outfield, exposed to sun. Happily they are doing it out. Ladies there in the huts, exposed to cooking gases, ill illuminated. But it should be the other way about. How come you can say gents? Sir, honestly telling you, I do not know. Believe me, again you took another photograph. It's a photograph of the ear. This particular thing is called as pinna in the medical system, medical science. It's called as pinna. What is the purpose of the pinna? Why it is there? What it does? What is the answer is, number one, for the acts as a funnel for the collection of sound waves, number one. Number two, nothing but a cosmetic reason. Any photography, something should be there to block, to have a projection. Only for that one you got 2 years. This is what my science told me in allopathy. But he said, as a medical student of 4th year, final year, and house surgency, I would have conducted more than 500 to 1,000 deliveries in Madurai medical colleges during my student days. But I have never imagined, I have never seen it with that eye, till my professor told me, he said, Muthu, see this one. At that time, he showed me the photograph of the ear. This ear, sir, all the viewers, I request you to kindly see the ear of your people who is sitting next to you, or you feel your ear by yourself. Have you ever imagined this shape of the ear as a fully grown fetus that is coming out of the mother's womb. Unbelievably, this is how a fetus will be placed in the mother's womb when it comes out. This is the head area, and this is the back, and huddled up. Honestly telling you, till my professor told me, I have never imagined, I never felt it so, even after seeing the position of the even after seeing the fetus in the mother's womb with hundreds of scans, everything. But I have never imagined this one, till my professor told me that one. I was totally taken aback. And he said, Muthu, this is our ear acupuncture. You got 136 points in the ear. Hard to believe me. This particular point, out of the point, this is called as the lobule. The particular point in the center of the lobule is for eyes. It is beautifully, the picture has depicted the point of eye. So the ladies, they use ear bore. It will be of bimetal studs. So all time, the acuity of vision will be, all time it will be stimulated and it will be always acutely normal. That is the reason, in those days, even for the male child, they used to do this ear pricking in your Tamil Nadu. This is what he told me. I was totally taken aback. Even our area, even for children, that is a male child or female child, it doesn't matter. At the end of the 1 year, everybody will do ear boring ceremony. It's a ceremony, family ceremony. Even today they are doing it. But we do not know why they are doing that. So because of that one, but out of civilization and other things, you threw everything out of it. You see the picture of warriors in those days, 1600, 1700. You think of the pirates, they will be used to wear a ring. That ring will be bimetal needle. So it is made of bimetal. So what will be there? It will be always the acuity of vision will be more, because when the enemy comes, you should be visualized when he was in a long distance. Because when binocular was not invented, this is how the acuity was very good. When he explained everything, I thought, okay, this is purely a science, which tells me more than what I have learned in allopathy. So that prompted me to run after him for more than, honestly telling you, believe me, more than 8 weeks I ran after him, actually. I was in Kumbakonam. He used to travel. He was on a transit in India. He used to travel from different places. I used to get his address, organizer, I used to get his address. Sundays, I'll put a holiday for my hospital. Then I'll go and meet him in person in that place. Bangalore, Hyderabad. Then Mysore, he was at Mysore. Then in Nagpur, each and every time when I go and meet him, he'll invite me, give me coffee and said, no, sir, I would like to learn acupuncture. No, we'll make it next time. He was kept on telling me like that. Only after 8 weeks when I met him in Nagpur, he said, Muthu, now I understood you are serious and sincere with what you are asking for. So let me teach you acupuncture. This is what I was taught acupuncture. Then after that, thank God I got a beautiful opportunity to be in Singapore, where I did my PhD for 2 years. Those are the beautiful things. 3 beautiful old Chinese people, they came and they taught me the beauty of acupuncture. Then I went and then I did my PhD there. Then I went in China and I worked there for some time. And each and every day, it is a beautiful time for me to understand more and more. Nobody can master any subject. Take it from me, not only acupuncture, any subject. Even today, I read my acupuncture texts because it gives you so much. That is the only reason I want to share all these things along with the medical knowledge to our viewers, and that is why I am here. Okay?